Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be talking to all of you about a recent review article that has been published in the Indian Journal of Arthroscopic Surgery and Sports Medicine, which is published by Scientific Scholar. We are here to discuss on the topic non-operative and operative management of posterior tibialis tendon dysfunction, a systematic review and meta-analysis. Now, to talk to us in detail, in depth about this article, we have with us today the authors, Dr. Raju Vaishya, an experienced orthopedic surgeon and joint replacement specialist at Indraprastha Appollo Hospital, New Delhi, and Dr. Jitendra Mangwani from the School of Healthcare, University Hospitals of Leicester, United Kingdom. So, welcome to Medical Dialogues, sir. It's really a privilege to be having you both on board here with us today.
Thank you, Nandita. Thank you for having us on. Really appreciate it.
Great. Now, sir, we're talking about your recent systematic review, your article that was published recently. So, to Dr. Jitendra, if I may ask, what is posterior tibial tendon dysfunction on which the review has been written?
Yeah, so we have lots of bones in the foot, lots of ligaments, lots of tendons. And you will have heard of Achilles tendon, which is at the back of the ankle. This is a special type of tendon which is on the inner side of the ankle, which is called the tibialis posterior tendon. And it's one of the most important tendons to get you off the ground a little bit. So when you are tippy-toeing or standing on it, on your foot, this is the tendon that's responsible, in addition to the mechanisms in the bones as well as the ligaments, such as spring ligament, for example. So it's one of the very, very important tendons that we look out for. It is one of the tendons that gets into trouble in this condition called adult acquired flat foot or progressive collapsing foot deformity. So these are different terminologies that you'll hear about the similar sort of pathology based on what the authors or the clinicians think the driving force might be.
Great. Now coming to Dr. Raju, how do you see the state of arthroscopic surgery and sports medicine which is developing in our country?
In India, the recognition and development of sports injuries, related treatments and arthroscopic surgery has seen sea change in last couple of decades. To give you an example, Indian Arthroscopy Society is now one of the largest national society in the field of arthroscopy across the globe with more than 4,000 members. So that shows the interest of young doctors to become sports specialists. And moreover, we have more focus on sports and sports-related injuries, prevention of injuries. And Indian Arthroscopy Society has done tremendous job in reaching out to smaller cities to train young doctors to do arthroscopic surgery, to give the insights of the preventive methods, the treatments, minimally invasive surgery, and so on. And hence, overall, there has been a significant development in the field of arthroscopic surgery and sports medicine in India. Moreover, Indian Arthroscopy Society for last 5 years has now its own journal called Journal of Arthroscopic Surgery and Sports Medicine, in which this article was also published. That helps fostering the knowledge and the opportunities for Indian researchers to publish their work and also to interact with global leaders in this field on this platform. And I'm sure with the initiative of Indian Arthroscopy Society and Indian government focusing on sports injuries, there has been a significant improvement in the care of sports-related injuries and prevention of these injuries.
Great. Definitely, sir. There has been an improvement, marked improvement, if I may say. Now, Dr. Jitendra, coming to you again. So what is the range of studies that have been included in this review, now that we're talking about this in a little bit more detail, and how significant is to have authors from different countries and institutions coming together to discuss on such a topic?
Yeah, great question, and I think both questions are very relevant. So I'll answer the first bit. The range of studies have been included for non-operative, i.e., without the operation studies that have been published in this particular topic, as well as the ones that have got operations in it. And tibialis posterior dysfunction is treated in a variety of ways. So unlike hips, where you have arthritis in the hip or the knee, and you have a replacement as the option, in foot and ankle, you have multiple operations leading to the same outcome. And there are more than one ways to skin a cat, as they say. So this review is quite comprehensive because it's got both non-operative arm as well as the operative arm. So people such as physiotherapists, orthotists, people who are looking after these conditions early on, they will benefit from it, as well as the well-established consultants who do foot and ankle surgery or general orthopedic surgery. They will benefit from the output of this. So we've focused on both aspects. It's also got the narrative systematic review as well as the meta-analysis, which is leading to much more of a robust kind of outcomes from it. So that's obviously the range of studies. In terms of collaboration, I think it is an absolute must in my opinion. So I'm known for collaborating on different levels for my studies, both locally, regionally, nationally, and internationally. And we've done loads of collaborations, and it's been a privilege to work with Dr. Raju Vaishya on this one in Apollo Hospitals. It's particularly important for me because I've now been inducted as a faculty here at the University of Leicester, where the University of Leicester has got a collaboration going on with Apollo Hospitals research centers in India to look at data sciences and precision health and so on and so forth. So I think collaboration is the way forward. Those dark days of one person doing research in a little room are well and truly gone, and thank God for that.
Great, definitely. So you get to see with collaboration, I think different school of thoughts get joined in, and that actually gives a very good outcome.
Absolutely.
Now, coming to Dr. Raju again, we know that cricket is the mainstream sport in India. However, sports like others like hockey, football, kabaddi, etc., which have their historic origin from our country, they all need much more medical attention and facilities. So, what is your take on that?
Rightly said, although cricket undeniably holds the special place in the hearts of Indians, but because of that, there is lack of medical attention and facility to other sports like kabaddi, hockey, football. And hence, these people who have to train very hard often get injuries for which they do not get proper treatment in time. They are also financially not that well off, and hence they cannot reach out to the specialist. Moreover, there is no focus on injury prevention and rehabilitation of these injured or these players in other sports facilities. So investing in medical infrastructure and support system is very crucial if we want to improve the overall health of these games, and India may then take the lead in these fields. And hence, I suggest there is more balanced sports culture should be developed in India with proper attention given to these sports beyond cricket. And in this collaboration with the Government of India, Educational Institute, sports organization is mandatory and should be given a lot of priority by everyone.
Yes, definitely. That is a takeout message here. Lastly, Dr. Raju, again, what will be your message to the young surgeons who wish to opt for this field, and how much awareness about the super specialty you think is still required in our country?
I think the young surgeons who are interested in sports medicine and arthroscopic surgery, first of all, they should stay passionate and committed to continuous learning. Learning never ends. And the more they learn new skills, new surgeries, then they can offer better treatment, which is minimally invasive, which gives early and faster recovery to the patients, and so on. And not only treatment, we have to focus on the preventive aspect of these injuries. So, both surgical skills and sports science is important to understand by them. Although there have been a substantial progress in the field of sports medicine and arthroscopic surgery in India, but I feel there is still a significant gap that needs to be addressed, and hence increased educational initiatives and outreach activities like presently Indian Arthroscopy Society is doing should be encouraged and continued.
Great, great. Thank you so much, Dr. Raju and Dr. Jitendra, for joining us today at Medical Dialogues and talking about your recent review article. And it was lovely to be gaining all your valuable insights on this topic. So, thank you once again for being a part of this.
Thank you very much for having
Thank
us.
you, Dr. Nandita. Thank you, Dr. Nandita.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.